Hi, Dr. Kent Sasse here in Northern Nevada, and I've been hearing some questions about the long-term effects of weight loss surgery in a couple of different avenues. One is, what are the chances of weight regain, and should I even consider surgery if people are going to regain their weight? And second is, are there other long-term consequences of weight loss surgery that I should be aware of? So let's tackle those a little bit with kind of the broad view of the published research. The good news is that nowadays there's quite a lot of long-term research. You can find some of this yourself pretty easily. One of the best sources is to look at the research that's come out of 30 plus years of research in Sweden. It's the Swedish Obese Subjects Study. And they have excellent researchers who followed and directly compared people who've had weight loss surgery to people who are in a similar boat but who have not had weight loss surgery. This kind of study, which goes 30 years and shows dramatic improvements in the health and longevity of people who did have weight loss surgery, is also replicated around the world in many other centers and many other forums. And so once you start digging, you'll probably find your way to many other long-term studies that look at large populations. There are also, of course, studies of all shapes and sizes now, randomized controlled trials, large observational studies, studies in the biggest, best journals with the most rigor. So we have better answers to the question nowadays than we used to, let's say, 20 years ago. So what do those studies show? Well, first and foremost, they show that the weight loss surgery is a very powerful risk reduction tool, meaning that the moment you have weight loss surgery, you begin to reduce your risks of serious health events such as heart attack, stroke, and death. This is incontrovertible. This has been shown, like I say, across the world and across ranges of study types. So there are a few things going on that make that happen. We know that we lower our risks because we lower blood pressure, we lower blood sugar, tends to reverse diabetes. We get much more favorable cholesterol lipids profile with far lower triglycerides. Plus, we just take weight off our system, our organs, our lungs, our heart, our bones, our joints, our knees, our spine. And so people are better able to withstand insults. They're better able to withstand adverse events like COVID or like a car accident or like a heart attack. And they're less likely to develop many other problems like blood clots, strokes, heart attacks, kidney failure, etc. So in general, we know that this is the case. We also know that it's not perfect, and we know that people have a genetic susceptibility to weight regain or weight maintenance that has a lot to do with their own biology. Some of it, no doubt, also has to do with the person's motivation and how well they do with continuing with some regular daily exercise like walking, and how well they do at continuing with a diet that's lower in carbohydrates and emphasizes green vegetables and protein. So there are a few inputs there that make a difference. What we can see lately in the last 10 or 15 years with sleeve gastrectomy as the dominant procedure is that somewhere in the neighborhood of 20% of people regain most or all of their weight at the 10-year mark. And then as you look down further in terms of how much weight people have kept off, you can say that certainly the majority of people have kept the majority of the weight off at the 10-year mark. So again, not perfect, but certainly you can see why that translates into such a huge health advantage for the long haul. So what if you look at those data through a lens that says, well, gee whiz, if it's not 100% successful, then maybe I don't want to do it. That's understandable, except that when we think of what alternatives exist, we realize we really don't have any good alternatives. The reason is that we don't have any alternatives that change that biochemistry. We know that we're not able to achieve long-term weight loss and remission of diabetes and health improvement beyond about 2 years without changing the hormone profile that regulates body weight and metabolism. And we know that the only way to change that profile and change body weight regulation and metabolism is by changing the tissues where those hormones come from. And that involves either trimming off part of the stomach tissue or bypassing part of the stomach and intestinal tissue. Short of that, we do not change that hormonal profile, and so it is always fighting against us. It's kind of like getting on an airplane that has a flight plan established. You might grab the wheel and steer it off the plan for a little bit, but unless you change the flight plan, the plane is going to be right back on that same trajectory. And that's what happens with all of us. That's what happens in the peer-reviewed literature on diet and exercise and non-surgical weight loss plans. people regain the weight at the 2-year mark or sooner in virtually all of them. You can kind of corroborate that if you look at meta-analyses of non-surgical weight loss plans in the published peer-reviewed literature. You'll find that that's the conclusion reached by even the most optimistic objective researchers. But what else happens long-term after weight loss surgery? Well, we know that, as I say, that on average people do keep off substantial weight over the long haul, and they have substantial measurable health improvements even going decades out. But are there perhaps negative effects? Well, there can be a few. Nothing is quite perfect. With gastric bypass or duodenal switch or more aggressive bypass type procedures, there can be diminished nutrients of a few particular micronutrients, specifically B12, iron, vitamin D. Those are kind of the top 3, but it could occur with other micronutrients as well. These are usually very easy to supplement. So it's a matter of making sure that you're taking the prescribed vitamins and then that you're testing down the road. So we usually test people's vitamin levels at least 2 or 3 times in the first year after surgery, and then usually annually thereafter for the long haul. And that's usually quite successful at identifying any particular problems or anything that's drifting off the norm and that can be supplemented. And usually that can be done with an oral supplement. In an extreme case, someone might need an infusion of something. Sometimes iron infusions are necessary. This is true in the regular population too, in people who don't have weight loss surgery, but it's definitely more possible if you've had a bypass type procedure and the iron is just not absorbing well. What else can be a long-term issue? Well, with gastric bypass surgery, there are a couple more things to be aware of. One of them is that a fraction of people will get low blood sugars, a reactive low blood sugar, what's called reactive hypoglycemia. So whereas hyperglycemia is high blood sugar, hypoglycemia means the blood sugar goes too low. And this is pretty troublesome because people don't feel good when their blood sugar is really low. They can feel confused, lightheaded, weak, tired, nauseated sometimes, and sometimes the only cure for it is to take in calories. So that can actually be a source of maladaptive eating or eating sugary foods and the wrong foods and regaining weight. So that's something to be aware of, and that does have some treatments that can help, as well as some eating strategies with protein and other snacks that have a slow onset and don't have a real fast spike in blood sugar. What else can happen? Well, in a few cases, people can notice that they're having dumping syndrome, which most classically is after eating sweets or high sugar, high osmolality foods. People with gastric bypass can have racing heart and hot flash and feel woozy. So usually that one is a matter of managing it by avoiding things like concentrated orange juice and sweets and ice cream and stuff like that. Usually that solves it. For the sleeve gastrectomy, the main problem that's a long-term potential side effect is acid reflux. So we still have, even in this modern era, we still have 10 or 12 or possibly more people who get worsened acid reflux as opposed to improved acid reflux. And this sort of remains the Achilles heel for the sleeve gastrectomy. Despite our best efforts and despite studying it, we do now succeed in reducing acid reflux in probably at least 70% of people with sleeve gastrectomy. And that comes by losing weight and by tightening the hiatus, that's the muscle valve at the top of the stomach, and in tightening that it prevents acid from refluxing. But we still get this subset of people whose motility is probably disturbed with surgery, and either early on or years later it begins to result in acid reflux. Somehow the squeezing of the stomach is forcing stomach secretions and acid up into the esophagus. This can be, a pretty big nuisance. Sometimes, for most people, it's really manageable with medications, but in a few cases, it requires surgery to revise it and create a resolution of that reflux. But there is a solution out there, and it can be resolved. Those are probably the main kind of long-term things that we see and deal with. So, if I just circle back and summarize, what I would say is there is excellent long-term data today regarding weight loss surgery, including all the major procedures. It results in profoundly reduced risks of major health events. It results in significant increase in life expectancy and health, with a reduction in stroke, heart attack, and other major health problems. There are a few potential long-term side effects, and those are a little bit more of them in the bypass type procedures, including vitamin deficiencies and hypoglycemia. And for the sleeve, it's mainly that acid reflux issue that we sometimes contend with. All of those are manageable, and there's always some solution to sort of work through them, even though it can be a nuisance to have to deal with different treatments, medications, or procedures to solve them, but they're solvable. Most people view those data as not perfect, but certainly a good bargain in terms of the benefits that are gained over that long haul. Well, I hope that's given you some perspective from the peer review literature of what are the long-term things to think about with metabolic surgery or weight loss surgery. And just keep in mind that just because a few people are known to fail or regain the weight, that does not mean that there's not a real large benefit in aggregate for people undergoing the procedure. And usually, even if that one person did fail or regain their weight, even they have good avenues to get back on track with revisional surgery. Well, I hope that's been helpful, and I wish you the best of health.